25-year-old woman is brought to the emergency department 12 hours after ingestion of 30 tablets of an unknown drug. We don't know what it is. The tablets belong to the father who has heart condition, chronic heart condition. She has nausea and vomiting, and this very important side effect is blurring and yellowing of vision. Her temperature is 36.7 degrees Celsius, pulse is 51, blood pressure is 108/71, abdominal examination shows diffuse tenderness with no guarding or rebound. Bowel sounds are normal, ECG shows prolonged PR intervals and flattened T waves. Further evaluation is most likely to show which of the following electrolyte abnormalities. What drug is this and what is the electrolyte abnormality? Okay, let's go with F. This is easy because the patient has taken digoxin. Very easy because of yellowing of her vision is called xanthopsia, as I told in the previous class. What are the other side effects of digoxin? It can cause diarrhea, vomiting, GI disturbance, correct? And it can also cause AV block along with beta blockers. If it's taken with beta blocker, it can cause AV block because it has vagal activity. Vagal action is there. Now, further evaluation is most likely to have which of the electrolyte abnormalities. Why increase serum potassium? This is the mechanism of action of digoxin. Sodium potassium ATPase inhibitor and calcium and sodium exchanger stimulation. So there is sodium potassium ATPase. This activity is inhibited, so there is increase in potassium outside. So this sodium will remain in the myocardial cell. So when it is remained in the cell, sodium is going out, calcium is coming in through the exchanger. So increased calcium causes increased cardiac inotropic effect. That is digoxin for you. So the answer is increased serum potassium. So hypokalemia can cause toxicity of digoxin, correct? As flatfish, hyperactive. So this you have to learn, commerce. Prolonged PR intervals and flattened T waves is one of the side effect. It is the one of the signs of digoxin toxicity. You have to learn that. It is given in Harrison's also. I don't think it's given in first aid. It's not due to hypokalemia. No, it's not due to hypokalemia. Hyperkalemia. Yes, you are right. Hyperkalemia causes hyperacute T waves, but this is not because of hyperkalemia. This is because of digoxin toxicity. Okay. Your thinking is right, but this is what you want to learn in digoxin toxicity. Okay. This I've explained, decreased, which leads to decreased potassium influx into the cells, and if taken in less, hyperkalemia will be there. Inhibition of sodium potassium ATPase also decreases sodium efflux from the cell, which decreases the activity of exchanger. This results in increase in intracellular calcium levels, in increased cardiac. It increases the cardiac inotropic effect, right? While hyperkalemia typically causes peak T waves, you were right. This patient's ECG finding of flattened T waves and prolonged PR interval are direct manifestation of digoxin toxicity on atrial and ventricular refractory periods. Okay.
Thanks for watching. Please give a thumbs up and subscribe for more.